The commencement of access to health care for 34,000 beneficiaries.
Yes.
Cikinsu an kira mace 40 da take a wannan wuri, so za mu kaddamar da wa'annan mutum biyar da ke nan. So
da suna Allah mai rahama mai jinƙai, muna godiya ga Allah da ya kula mana wannan lokaci. Kamar yadda kuka gani yau ga masu juna biyu su ma za a ba su nasu katuka. Abin da ya kira gare ku ne shine ku sani wannan katin ne wanda yake shine zai sa ka samu magani kyauta. In kika yi wani tsinta ya kare shi ko ya lalatar da shi, sai ka rasa wa dama da aka baki. Mai girma gwamna ya ce a baki a matsayin ɗan da za ki haihuwa ya zama cikin samu sauƙi ba tare da wasa a kula da wannan katikar a yi wasa da shi. Allah shi ba da lafiya. Allah shi ba da lafiya. Kuma kin ji bayanin nan baki. Kada ki wasa da wannan kati, a yi kokari a rike wannan kati shine na zuwa a ga likita, sai da ganin wannan kati sai na zuwa a ga likita. Allah ya ba da sa. Kin ji bayanin mun ne ko? To Allah ya ba da lafiya. To Allah shi kara lafiya.
The former Secretary, the Ministry, Pharmacist Aliyu Muhammad Maikio Maradu, as well as the Executive Secretary, Zamfara State Primary Health Care Board.
A yanzu za ka kaddamar da ɗaya bayan Allah. Wannan katin shi ne katin da in ta zo asibiti za ta gabatar ma malaman asibiti da wannan katin. Saboda kuma ta muna ƙara neman haɗin kai da goyon baya na ganin an sa ido da tsawatawa ƙwarai da gaske. Kuma ƙofar abu da take mai martaba duk lokacin da aka samu wani ƙorafi kuna Najeriya tsira gare su da mu gobe kiyama. Bayan nan kuma bayan Allah ma juna biyu muna roƙon Allah ya raba lafiya. Yaran mu kana waje kuma Allah ya rubuce mu da baki daya. Sunan Allah muna kannan. Za mu gayyato babban sakatare na ma'aikatar lahiya pharmacist Aliyu Maikio Maradu domin jawabin gobe. Famsek.
Program of access to care for the vulnerable under the Basic Health Care Provision Funds Program. Your Excellency, today's occasion marks another milestone in the state health sector reforms where vulnerable populations across the state have access to affordable and qualitative health care services owing to your total commitment, interest, continuous support to the agency since its establishment. These beneficiaries will access healthcare in the NHIS accredited healthcare facilities ranging from comprehensive health centers, primary health centers, and general hospitals to provide primary and secondary services across the state. Your Excellency, you may recall that the enrollment of participants into this scheme was launched by His Excellency the Executive Governor of Zamfara State on Wednesday, 18 November 2021 at General Hospital Gusau. And the agency had successfully registered a total number of 34,000 venerables in 147 political wards under the Basic Healthcare Program funds to cater for the vulnerable population, which include pregnant women, children under 5, aged, disabled, and displaced persons as a result of banditry in the state. I would also like to use this opportunity to reassure His Excellency the Executive Governor of Zamfara State about the agency's total commitment to ideal and goals of the administration in protecting families from hardship of huge medical bills and ensuring judicious utilization of the resources to continuously improve the healthcare delivery system in the state.
Your Excellency, you may wish to know the Basic Healthcare Provision Funds was established under Section 11 of the National Health Act as the principal funding vehicle for the basic minimum package of healthcare, and at the same time serving to increase the fiscal space and overall financing to the health sector. It is expected that the attendant service upscale arising from application of this funding will assist Nigeria achieve UHC funding of basic healthcare provision funds will be derived as stipulated in the Act from an annual grant from the federal government of Nigeria of not less than 1% of its consolidated revenue generation grant by 1% of its consolidated revenue generation, and also grant by international donor partners and the funds from other sources like equity funds, which are supposed to be paid by the state government. Your Excellency, let me state here clearly that His Excellency, the State Executive Governor, has graciously approved the payment of equity funds to this agency, which will be implemented hopefully end of this month, inshallah. The operational guidelines of basic healthcare provision funds has been reviewed such that implementation of the scheme becomes more realistic. Provider payment mechanism was also reviewed by introducing capitation payment to healthcare facilities at the primary level. At the primary level care, whereas fee-for-service was approved for secondary care services after a referral procedure and protocols are duly followed, among others. Your Excellency, I'm happy to say that the scheme is envisaged as one of the successful reforms in the health sector, with a target for both formal and informal sector programs of the scheme. The administration of His Excellency Dr. Bello Muhammad Mutawalla Maradun, Bandar Kasa Hausa, Shatiman Daular Usmaniya, will not relent in its efforts in ensuring the good people of the President have access to quality care services in the state. On this note, Your Excellency, distinguished ladies and gentlemen, I would like to express our thanks and appreciation to His Excellency, the State Executive Deputy Governor, and his entourage for finding time to grace this important occasion. I want you to know that His Excellency traveled out of the state from Zamfara to Kano, Jigawa and Bauchi, and he came straight away from Kano to Talata Mafara simply to witness this very important occasion. Your Excellency, we are highly grateful.
All praise be to Allah, the most merciful, the most gracious. It is a hard working and a great delight for me to join you and equally welcome you to this important occasion in the history of Zamfara, the flag of the contributory healthcare scheme. As you are all aware, ladies and gentlemen, access to affordable healthcare continues to be a challenge for most households due to high level of poverty and significant reliance on out-of-pocket expenditure. Hence, health insurance population coverage throughout the country has remained low. This challenge forced most states of the Federation to domesticate the NHIS based on their religion and traditional value system and other peculiarities. It is over 2 years now that His Excellency Dr. Bello Mutawalla Maradun commissioned the office complex of the State Contributory Healthcare Management Agency. And I'm here I'm happy to say that the scheme is in the stage as one of the successful reforms in the health sector with over 15,595 prospective enrollees in the formal sector program and 34,000 vulnerable population to be covered under the basic healthcare prevention funds. In line with the state poverty drive to strengthen the state health system, the state government has approved 1% to State Contributory Healthcare Management Agency as an equity fund for the vulnerable groups and matching the grant of the basic healthcare provision fund, and also to augment the risk pool of the contributory health scheme. Ladies and gentlemen, the primary purpose of the State Contributory Health Management Agency is to significantly reduce the healthcare expenditure among the population of the State residents. Such will be feasible by ensuring adequate and sustainable funding that will be efficiently and affordably be used to provide quality health services and ensure financial risk protection and access to health services for all the State residents, particularly the poor and the vulnerable. All those are part of the government intervention towards setting up a sustainable healthcare delivery system that will drive the process of achieving universal health coverage by ensuring all residents of the state have access to effective, quality, affordable healthcare services. The protection of families from the financial hardship of huge medical bills and ensure improvement of the health facilities throughout the state. So which means Dr. Bello Matola Maradon has expanded pre-education, pre-health services. Our mission to achieve universal health coverage for all the residents of the state where no one is left behind in accessing health care. Hence, we need to provide a credible and sustainable mechanism for pooling of resources to the finance health care provision under the scheme. Implementation of the scheme is a peculiar tax, but the smooth operation of the Zamfara and the accomplishment of the projected result will essentially depend on the commitment of the government. This administration will not relent its effort in ensuring that the good people of the state have access to quality health care services. On this note, finally, I wish to express my appreciation to the Honorable Commissioner of Health, the ES, and his team for meeting up with this obligation by different stakeholders: the state government, the organized level, the CSO, the NHI development partners, providers, and most importantly, the beneficiaries. This is a clear indication that this agency has all it takes to be a point of reference in achieving universal health coverage with the state. Allah is Saka, Masud Alheri. Thank you and God bless.